leads to. Very serious one be that. And I make they always talk, make it be same person they, make sure say they always check your breast because early detection better. Well, we no go fit talk all this matter here because we get ogbonge doctor we go follow sit down to put mouth for inside this matter to teach us every way we get to know concerning this breast cancer matter. And she dey join us for Zoom right now. She be Dr. Bukky Oshinkalu. She be oncologist and she be senior registrar for inside Lagos State University Teaching Hospital, Luth. She dey here to join us. Doctor, good morning. You dey hear us?
Yes, so good morning.
Good morning, doctor. Happy International Women's Day. For all I care, the whole of this month is still our own.
Yes, so thank you very much.
Thank you. My name is Precious Eyi, and Ochuko Omiragwa are here with me. We go follow ask you questions concerning breast cancer matter. So this breast cancer issue, first of all, I beg, we could touch light. I'm waiting be breast cancer. We could start with that one first.
Okay, breast cancer now. First of all, cancer na disease wey we say it affects different cells for body. If it affect all cells with the body, you need cells where you know if it affect. You know if it affect the hair, you know if it affect nails. So hair and nails basically. So and also the teeth, those three organs, it can't affect them, but every other cell, cancer can affect them. So cancer na disease where we say those cells for the different parts of the body, then go just begin they increase, they multiply, they grow, and then they can go affect another part of the body. So for example, now this breast cancer we want to talk about, it go start for the breasts, and both women and men and get breast. So it will start from the breast, and then from the breast it spread go other areas. So now the thing where breast cancer be that.
Okay.
Now, doctor, you say this breast cancer, they fit catch both male and female, but it be like say it dey common more amongst the female gender. So why it dey like that?
Okay, so the breast cancer it is more common among females. As a matter of fact, now only 4% of breast cancer they affect men. So the reason we say na the risk factors, those risk factors where they associated with the breast cancer, because generally cancers we don't know what they cause them. We just know say some kind lifestyle or habits or just things to do with the person and they predispose them, they put them at higher risk than other people. So specifically now for breast cancer, the things where they will be risk factors for breast cancer. One, if you be woman. So mere fact say you be woman, it puts you at risk, higher risk than men. So even though the thing will affect both men and women. So but if you're a woman, you're at higher risk for breast cancer. Also another one, the older you are age. So the older you're getting, the more at risk you are for breast cancer. So another one, something like hormonal factors, So things like women where you never born before. If you be woman, you never born pikin at all. They call them nulliparity, they nulliparous. They more at risk than women we don't born children. And then the earlier age, na still hormonal factors I discussed, the age where you take start menses. So girl wey start menstruation at 10, they more at risk for breast cancer than girl wey start menstruation at 14. Because the hormones we responsible for that, it don't start the work for a time. So that's the estrogen hormone now. So for girl will be 10 years we start menstruation compared to somebody will be 14 years before it starts. So that girl will be 10 when it starts 9 they more at risk than someone will start later. The same thing for women where they reach menopause. Those of them will reach menopause later. For example, now somebody will reach menopause 45, meaning stay in period stop at age 45, compared to somebody where you won't stop age 55. That woman where you won't stop age 55, she dey more at risk than somebody where you won't stop by age 45. So the earlier you start menses and the later you stop menses, the more at risk you are for breast cancer. So another one is breastfeeding. Women where they breastfeed their children, then get protection from breast cancer than women who no breastfeed their children. And this protection from breast cancer, it is the longer you breastfeed, the more protection you get. So woman wey breastfeed in pikin 6 months compared to somebody wey breastfeed up to 2 years. The one wey breastfeed up to 2 years, you get more protection against breast cancer than somebody wey breastfeed for only 6 months. So now the hormonal factors be that, and then women too, where they use family planning, those hormonal family planning. If it be the one where they swallow as tablets, or the one where they take as injection, whether na 2 months on or 3 months on, or sometimes they will just put, they call them implants, they will just put them under the arm, the skin of the arm. But now hormone contraception or hormonal family planning, women when they use those family planning, then they more at risk than women when you use hormonal or when you use other types of family planning when you involve hormones. So,
okay, so as you don't mention,
women more at risk compared to men with that.
So as you don't mention all of these risk factors and all that, we make, of course, women, they more likely to get breast cancer past women. It gets how we use prevent them, because unfortunately, most of these things will not feel just stop to the drum because we'll be women. That things will be say make us women. And some of them not be things will get direct power over. So what's be the things where women feel do in terms, of preventing this breast cancer? Or to help to slow down the process where the likelihood of it happening to you?
Okay, thank you for the question. So, these risk factors, what I don't mention, some of them, like you talk, if you do anything about them, but some you can do something about them. Another one, what I not be mentioned before, alcohol intake. That one, if you do something about them. So if you take alcohol, either you stop them or you reduce them completely, because it's also a risk factor for breast cancer. So another one, what I not be mentioned before, obesity. That one, you can do something about it. Obesity in a way woman will be too big for in height, because obesity is a comparison between how much you weigh and how tall you are. So if you are somebody that comparing your weight to your height, you are in the obese range, anything from BMI of 25 and so on. Make I not talk too much grammar. Basically, if you get weight too much, you fat well, and say tall, good. So the thing where if you do to reduce your risk for breast cancer, now to reduce your weight. So you go to do exercise, go to chop small, reduce your portions of food, like that, and then eat healthier, eat more vegetables, have a lot of vegetables in your diet. So now compared to about the things where fit do anything about, those ones, whether you get pikin, get pikin, the one whether you woman or you increase in age, everybody will all increase in age. So those ones you really can't do anything about them. So for those ones, you just need to screen. That's why screening is important. Breast cancer now one disease where you say, if you screen, they do self-breast examination. They examine your breast by yourself. If you detect it early, and then once you find any sign at all, a lump, most of the time a painless lump, that is the commonest symptom. Find a painless lump, go to hospital immediately. Don't delay. So you
the talk say early detection fit give the person.
You screen, when you screen, detect it early, and then go and seek treatment on time.
Okay, so you talk say early detection.
You can do something about, then you do something about it, like reducing your weight, like choosing other forms of family planning that don't have hormones in them. For example, now copper T, intrauterine contraceptive device, they call it copper T. You can do that instead of taking hormones. It reduces your risk for breast cancer.
Okay, so doctor, the talk say early detection fit help person survive and it fit lead to the cure. So how person fit use detect them early? What's be the process of examining the breasts? What person need to do, and how frequently person need to do them?
Okay, so for self-breast examination, it is to be done at least once every month. Okay. For some women, where you say they don't suffer breast cancer, and we will just do 2 anxious, and we say, doctor, now every day, me I go to check them. You don't need to check them every day. Once a month, you don't do.
Okay.
So for women who will be say, they still they see their menstruation, with their advice, they make it be say, for example, now, today, now, for example, if their period starts on the 1st of March, they advise them, say 10 days later, that is 1 + 10, 11. So by 11th of March, they would examine their breast. So usually 10 days from the day the period starts. So that's what we advise women who are still menstruating to examine their breast. So this breast examination now, then go, if they get mirror, then fit stand in front of mirror, then go first look their breast, they will comot their clothes, their shirt, their bra, then go then care from waist go up, so that they can observe breast, the skin of the breast very well. If they have a mirror, very good. If they don't have a mirror, they can just use their eyes and look at it. So look at the breast. What is the shape of the breast? What is the size of the breast? For some women, the right breast, if it big past the left, some the left if big past the right, is okay. Just know the one way big pass, so that any day, let's say na the left, na big pass right. So one day you can't see say na right, na become big pass left. Say something don't they go on for that right. So if you begin to examine your breast regularly, you will know the normal shape of your breast. You will know the normal size of your breast. You will know the one way big pass. You will know whether then they equal sized, such that any day way we say one come big past another, you will know say something don't they happen there. So after you now look, apart from the size and the shape, you also look for skin changes, whether the skin don't change color, because sometimes if you notice some women, usually because we're always wearing clothes or shirts over the breast generally has a very smooth and fine texture. So any day you notice that some black spots or some red spots dey the skin, make you draw your attention, go there, check them well whether anything dey there. So after you look the breast now, you come begin to press the breast. Go use your fingers, the finger part of your hand to just press down. You can divide the breast into 4 imaginary quadrants. You check each quadrant means that you divide it into 4. So you check the upper one, the lower one for one side, and then the other side, check whether any lump dey there. Commonest symptom of breast cancer na painless lump. Lump na boils, like something like small boil, inside the breast. We know the pain, the pain. By the time you begin the pain, the thing don't go far. So now you make way, be say, self breast examination, they very, very important, because now one of the ways where you feel detect, say, something they grow inside my breast too, so that you can go see doctor. And all right. So when you divide the breast into 4 imaginary areas like that, you use your finger, take press and check whether any lump or any small boil inside. So if you notice you go see your doctor quick. So after you don't do that one, the nipple area na the area where if for woman where they breastfeed, where milk they come out. So that area is black in color. So that area self, you need to examine that area self, check whether any lump dey there, because sometimes if you check the other areas apart from the nipple area, you don't go see anything. But you can't check the nipple area, you can't see something there. So that one too, you need to check them. So after you don't check those 4 areas and the nipple area, press scan with your fingers. If you don't see any lump, fine. So another area when you do self-breast examination, where you suppose examine na the armpit, because like I talked before, cancer and a disease where you say if you go start one place, if you can't go another place, now they make it dangerous. So after you examine the breast, you will also examine the armpits, because for breast cancer, the first place where you waka go, if you come off for breast, now the armpits, now the waka go. So when you do your monthly self-breast exam, you're supposed to examine the armpits as well, so that if any, or sometimes you go even see lump inside breast, you go see that small boy who talk inside breast, now inside your armpits, you go see them. So you're supposed to examine the armpit as well. So you go do on one side at a time. You do examine the right breast, then the right armpit, also the right nipple. You press the nipple, whether anything will come out. Because sometimes so you go see lump, now just discharge, now you go see for the breast. Where we say, the breastfeed pikin, your pikin, maybe your last pikin don't reach 10 years, or your last pikin don't reach 4 years. You can't press your breast. You see say water they come out, whether na colorless water, or na bloody water, or na milky water, not supposed to be. So either you see lump for breast, or you see discharge from your nipple. Where you say your last pikin don't grow well, or you don't even get pikin at all. You can't see water they come out for your breast. I beg make you go see doctor. So when you don't do one side finish, you enter the other side. The breast, the nipple, and the armpit. Now so once every month. Yeah, for doctor. Women, I thought before saying 10 days from your period. For women, when they see menses, may they just choose any day of the day where they like between 1 and 28.
Thank you, doctor. Yeah, doctor, so you don't
be your favorite number. 20th of every month for women when menses don't stop. Then go examine their breasts. Okay. Don't talk, so that if they see any lump, or they see discharge, or they see any change when no did it before. I beg, may them go see their doctor.
May they go check the doctor.